Well, it is a health issue that's embarrassing and sometimes difficult to talk about. Millions of Americans suffer from overactive bladders, using the restroom many times a day and actually fearing that they may have an accident. But now a new treatment option could help.
And there are behavioral treatment options for an overactive bladder, and then there are drug treatments, but some are turning to something called nerve stimulation treatment. Joining us now, board-certified general surgeon Dr. Garrett Peel to explain how this treatment works. Good morning, Dr. Peel.
Good morning.
So glad to have
Good
you.
morning. Gotta go.
Yeah, you've
Right
got the
now,
commercials.
yeah.
Right. How prevalent, how big of a problem is this?
You know, 16 to 20% of Americans suffer from overactive bladder of some sort. And those patients who have diabetes and depression are 4 to 5 times more likely to suffer from overactive bladder. But others that are over 75, those that have arthritis, and those that have had previous urinary tract problems or chronic urinary tract infections also are at higher risk for developing OAB.
Yeah. Are there any symptoms that we should look out for? I mean, obviously having to go more than normal or more than what you think is normal is a symptom, but is there something maybe hidden that we can
The criteria is urinary frequency greater than 8 times a day. Okay. And then urgency, so the need to not only go frequently, but the
here it is right now.
That, hey, I need to go right now. And then also incontinence. So a lot of people feel that if they don't have incontinence, they don't have an overactive bladder. But indeed, essentially, it is you need to void multiple times in a day. Also at night, if you get up more than one time in the night to go urinate, it is significantly considerate for OAB.
I mean, and that could really put a crimp in your lifestyle.
Oh my gosh, sure,
absolutely. Absolutely.
Okay, so talk about the traditional treatments then. What are people usually doing?
Behavioral changes are important. So not drinking a lot before you go to bed, trying to train your bladder so that you can get to the restroom in a expedient time. Do scheduled bathroom breaks. If that doesn't help, there are some over-the-counter and prescribed medications such as oxytrol, and then also some anticholinergic medications that help release those muscles. So Enablix, Tovias, we've heard of Ditropan, and also Vesicare are some options. But again, these are basically treating overactive bladder. They're anticholinergics. They release the muscles so that the bladder can feel more. And the key here is also to understand that these anticholinergics can actually have some side effects. Dry mouth is most common, and some gastrointestinal problems as well. Also, patients complain of blurred vision at times as well.
Right, so you have something else to tell us about the nerve stimulation. What's that?
So the nerve stimulation is a new treatment, and it requires about a 12 to 15 week process, but a small needle is inserted into the ankle right at the nerve that actually stimulates the spinal nerve that innervates the bladder. And this nerve controls the bladder, and it's essentially basically a minimally invasive office-based procedure that doctors can do to treat overactive bladder, and it's covered by most insurance, but it requires a commitment. It's a 12-week treatment, but 60 to 80% of people that complete that treatment really do find good results in their OAB without having medications. But the first step is behavioral training, medications, and then the minimally invasive approach. But what's more important here is that if you're having urinary frequency, if you're having urgency, go to your doctor. Talk to your doctor, because it could be something else. It could be a urinary tract infection or, God forbid, some kind of cancer. So it's very important to seek treatment first. Just don't go and get an over-the-counter medication because you have to go, gotta go. Get a relationship with your doctor about your urinary frequency.
Absolutely. Is everyone a candidate for it, or is there certain things that you guys look for on maybe who's better suited for this new nerve treatment?
Again, the patients need to have failed other treatment first, and then also patients should not have diabetes or peripheral nerve problems, or sometimes the procedure won't work if they have real swollen ankles as well.
This doesn't seem like something that would hurt much, right? Just a tiny needle. Does it have a lot of pain associated with it? Do they have to
Patients do not complain of a lot of pain, actually. It's tolerated really well, and because it requires a 12 to 15-week treatment, they keep coming back. And
better than the pain of having to go all the time. I mean, that could be a real pain.
It can be a real pain for a lot of people who suffer from OAB.
Yeah.
Are there particular questions that people should know to ask their doctors? How do you bring this up? It may be something that's kind of sensitive.
Sure, some people are sensitive about it, and I would basically encourage patients to be very honest with their doctor. Look, I'm having this feeling that I have to go urinate frequently. I'm getting up in the middle of the night, because those symptoms could also lead to other problems. And it's real important to just be very upfront, very open, and develop that relationship with your doctor. We're here to help.
Well, boy, if there's one person you can be open and honest and not embarrassed about anything with, it is your doctor. Exactly. Yeah, you should. Wow, pretty cool new treatment. That's going to put a lot of smiles on faces, I think, to know that there's something out there. Dr. Peel, good to see you.
Good to see you all.
Thanks so much. More Daybreak when we come right back.
And it's now 7:46.